So far, we've been developing medical care that's based upon interventions, diagnosis, expensive treatments, but not really looking at prevention. Last show, we were talking about a new field of medicine, anti-aging, wellness medicine, a number of names, but they all connotate taking a look at the way the body works so that we can maximize its health and keep it going at the best possible level it can exist at. And we're talking with Dr. Alan Terlinsky, who happens to be a pioneer in that field. He's also an internist, a blood pressure specialist, a kidney specialist, and he's also got a lot of experience with weight loss and bariatrics, as we call it. But our show last time talked about new age of medicine and, in particular, looking at hormones. Now, hormones, we know, are very important to our body, and we were talking about how they change as you age. And I'm not sure that we necessarily have to go back there, but we may touch on that just to remind people a little bit. But we were talking about longevity and about quality of life. And I guess the first place I'd like to start is, what is longevity? What does it mean in terms of, well, the lifespan?
Okay, well, theoretically, every biological organism, whether you're talking about an amoeba, a mouse, or a human being, has some built-in maximal capacity to live. And so longevity refers to the degree to which you live to your fullest capacity of lifespan. Lifespan being from the time you're born to the time you die. So with humans, those people have estimated the potential lifespan. Some people will say it's possible maybe to live 120 years. Most people don't. Most people pass away far sooner than that. But what it comes down to is we are, in the anti-aging community, are trying to optimize patients' health along the course of their life so that they do live their full potential. Not only live, but live healthy and live with a quality of life. That's really what it's all about. So we can talk about a lifespan being from the day you're born to the day you die, and what you want is your so-called health span to track that same curve. But however, in many cases, people around age 50 may suddenly, even though they're alive, they may have a deterioration in their health span. So they may spend 20, 30 years unhealthy, having many medical problems. What we want to do is eliminate that, and so that your health span tracks your lifespan.
So really the goal is, as I was saying, all those people expending so much of our resources in those last 3 or 4 years of life, and that's really sort of an accumulation of problems that they've acquired over that period of time. We'd like to have people actually live healthy, almost inexpensive medical lives until the last 3 or 6 months before they really do deteriorate and head to the inevitable.
Another way of looking at it is some people feel it's inevitable to, you know, if you didn't have parents that lived very long, that you're likely not to live long. In other words, it's a genetic issue. But I think genetics, in all these cases, it's important. So, you know, maybe as it is with other cases, we say that the genetics loads the gun, but the environment or your lifestyle pulls the trigger. A simplistic analogy would be, say, 2 cars were made on the same day at the same time, the exact same models. And as they're created, they all have little tiny defects. They're perfectly brand new. And the first year that they're driven, those defects are not going to be apparent. One owner is meticulous, changes the oil, you know, doesn't beat up the car, takes care of it, does the routine maintenance. The other doesn't. And so those 2 cars, one may last 10 years and one may go after 3, but they were given the same equipment. And so that's an example of longevity of a car. It's dependent on other factors. So we think that there's ways with humans to do the same thing.
It's a good analogy.